Doug can say that he doesn't work for a 501c4. So, one thing, we've got a lot of people standing in the back. If there's some empty seats in your row, if maybe you could move to the middle of the row or something, and we'll let people start sitting down if they choose. The other thing I would say, and Doug didn't say it, and I think it's something that we all in politics tend to forget to do on occasion, and I think it does mean a lot. If you get a spare minute, give Rand's office a call or send him an email and just thank him for standing up for us and for opposing the Patriot Act. You know, they get beat up a lot by leadership of both parties, by the media. And I think just knowing that there's thousands of people out there that appreciate what they're doing means a lot. So not just Rand, but any of the members of the House who voted against the Patriot Act and hopefully will vote against it again today, at the appropriate time, just shoot them a quick note of thanks, saying we thank you for standing up for us and standing up for the Constitution. Anyway. Next up to talk a little bit about healthcare is Dr. Michael Vasovski. Dr. Vasovski is a general practice physician from Aiken, South Carolina. He's practiced medicine for almost 25 years. He's a graduate of Texas A&M University with a degree in biology, and he received his medical degree from the Texas College of Osteopathic Medicine in Fort Worth, Texas in 1981. He also served 6 years in the United States Army Medical Corps, including 2 years as a brigade surgeon in Germany. Dr. Vasovski and his wife Cindy were strong supporters of Ron in his presidential campaign and are now both very strong supporters of Campaign for Liberty, and by the way, thank you for that. He was a candidate for Congress in South Carolina's 3rd Congressional District in 2010, and now has become South Carolina Region 3 Coordinator for Campaign for Liberty. So please welcome Dr. Michael Vasovski.
Thank you all very much, and I've got to tell you, it is a delight to be here. And since John's told us that we have a few extra minutes, I want to give you a quick glimpse of what brought me here today. And everything he said about the bio is correct. Went through the Army, spent umpteen years in Aiken in a small town solo general practice. And in 2007, channel surfing, on May 15th, the Republican debates popped up. I didn't turn that on, I didn't intend to watch it, but it popped up. And the usual suspects were there, and there was a gentleman on the far right, and he stood there and he said, "I'm Ron Paul, and I'm the champion of the Constitution." And I listened to that for a few more minutes, and I said, this guy is speaking the truth. My wife and I have been married for 33 years, and we don't agree on many things. But when I told her about Ron Paul and told her the stories and the things I'd learned, it was instant. It was instant agreement on what was going on. So I had verification that what I was seeing and hearing was real. And literally from May 15, 2007 to this moment, while I've still maintained a full active practice, the free time, the funds that we can contribute to this thing have come to here, and they will continue. So Steve Bierfeld called on Tuesday afternoon, and he said, "Mike, we need somebody to talk about healthcare. You come into CPAC, would you give us 10, 15 minutes? And I said, sure. I was walking out the door to go from Aiken to our state capital, Columbia, where a hearing was being held for the state of South Carolina to start coining gold and silver coin. I suspect I know where that started from. And I didn't go to the hearing, but I went to a program the night before, and Nicole Quinn was there, and we heard Tom Vieira, maybe not Tom, but Dr. Vieira, and we heard other people talking about gold and how it can be done, gold and silver coin, how it can be done digitally. I'm not going to belabor that point right now, but it can be, apparently it can be done, and they're looking into it in South Carolina. So keep an eye on the Campaign for Liberty website. Talbert Black is our state coordinator, and he's got a lock on everything that's going on in the state, and he's a great reporter, and he'll keep things abreast. So I was asked to talk about healthcare, and I said, well, what can you talk about in 10 minutes that hasn't already been beaten to death? And I picked two things. One, everybody's heard about, and that's the mandate. And the mandate, hopefully, is the Achilles heel of this whole thing. Because if they can, it's been declared unconstitutional in Florida, and if that can work its way up, maybe that thing can be sidetracked, eliminated, killed, repealed, whatever, with the courts. If not, then they'll have to fight on some other way. But it's the idea of the mandate that is so disgusting. It's so disgusting that we could be forced to buy something we don't want. And we're told that what we're buying is insurance. And as a general practice doctor who's been at it now for 31 years, I can tell you unequivocally, it's not insurance. It's not insurance when you're forced to buy it and you're paying exorbitant amounts of money for something with high deductibles that is just simply not insurance. It really should be called a benefit. You're buying into a benefit to get some health care through that system. But as I looked up the numbers and verified that this stuff is correct, there are 46 million people without health insurance. And 46 million people is about 15% of our population. And as I go through my day-to-day and week-to-week in my medical practice, I see that about 10 to 15% of the people who come, they pay cash. They are self-insured. They pay for their medical care when they need it. And those people tend to be very interested in how much things cost. Oh, you think I should have an MRI of the brain because I have headaches? Well, doctor, what does that cost? And them asking me what it costs prompts me to go shopping for them. And it is stunning, the difference in the cash price of these things when you go from hospital to clinic to radiology center. One way we can save money is start shopping for these things. Start make the consumer responsible, or at least aware of the difference in these prices. So it can, it can be done, and we should have the right to choose not to have health insurance if we don't want it. That's the bottom line. We should still have the right to choose not to have health insurance if we don't want it. There's two things you've got to remember if you're going to do this self-insured health plan. Number one, you got to put some money away. And it's not very hard to put some money away. If the premiums for health insurance now start at $500 a month and go north of that to in excess of $1,000 a month for premiums, if people took that money and forced themselves to put it in a savings account, they would quickly have a reserve in case something does happen. Put some money away for a rainy day. And the second thing you've got to do if you want to be self-insured is you've got to have a relationship with a doctor who you can call up and say, hey, I've got a sore throat, or I've got a headache, or whatever. It's got to be a relationship that you trust, and that person's got to know that you're self-insured, and he's got to work with you on this whole thing. And we're doing this in our practice, and as I recall, when I started looking back and listening to Ron Paul's history, he did that in Texas in his OB practice. He had a lot of self-insured people, and he did charitable work, and what he did, and I remember distinctly, he said, when Medicare came around, he was still in the height of his practice, he said, no, this Medicare doesn't sound right. I'm not going to participate with it. And he never participated with those government health plans, as I recall. So developing a relationship with a doctor and then carry that forward. Now, second issue. You don't tell me when I get too long. Second issue. We in healthcare are being pushed, coerced, stimulated with stimulus money to the tune of $19 billion to bring the electronic health record or the electronic medical record into the doctor's office. Now, we all know that computers are great. I'm not a computer hater. I have several of them. I love my computer. But I'm telling you, when those computers are in the doctor's offices, for things other than filing insurance and accounting, when they get in there for the clinical stuff, you can be darn sure that that information is not secure. And if the Pentagon can be hacked into multiple times, rest assured that doctors' offices can be hacked into, and that private confidential information can be accessed. And we've got to guard that privacy, because when you go into that doctor's office and you have whatever problem it is, it might be something that you wouldn't readily want shared with anybody. And it destroys that patient-doctor confidentiality. I want to read this so that I get it exactly right. From Tech World, it's Pentagon. Yup, we got hacked. U.S. Department of Secretary of Defense William Lynn has admitted that the Pentagon suffered serious security breach in 2008, an incident he categorized as, quote, the most significant breach of U.S. military computers ever. And it goes on to describe what happened. And just last week, what did we hear? We heard that hackers penetrated the NASDAQ computers, the NASDAQ stock exchange. And that, lo and behold, it's been going on multiple times, and they still haven't been able to pin down who's doing it. So when the salesmen come for the computerized medical records to my office, I say, guarantee me that what I put into this thing, the things that I find about the patients and diagnoses that are made, are secure. They can't do it. They can't do it. Not yet. It's not there yet. If the Pentagon can't keep them out, the electronic health record can't be kept out. And I think that that confidentiality issue is sacrosanct, and it's got to be guarded. Therefore, in my office, we continue to use paper records, and those records are kept secure. So, now, one last point as I'm thinking about this, you're going, why is this guy? Is he a conspiracy theorist? What's going on here? He sounds a little paranoid. Talk to Daniel Ellsberg. Now, some of you may not be old enough to remember Daniel Ellsberg. I do. He was labeled the most dangerous man in America because he's the guy who was instrumental in writing the Pentagon Papers and leaking them. And when the government wanted to discredit Daniel Ellsberg, what did they do? They sent CIA agents to his psychiatrist's office to find his records from his psychiatric visits so that they could discredit this man. And the thing that saved him was that the doctor's office was so disorganized, they couldn't find the chart. That's a fact, a funny story, but true. In any case, having your own health insurance is possible. Be very leery of the medical information getting out, and continue your work that we're doing for the Campaign for Liberty, and hope and pray that we get the word that it's a go and we can relive 2008. Thank you.